Hi everyone. Our topic for this module, Module 3, has once again taken on a whole new meaning over the past year. In this module, we continue our conversation about our public health system, but let's now expand our understanding to include how we access this system, along with implementation and improvement. Our 3 case studies this week really highlight the different aspects of these concepts. Turning to Module 3 objectives, our first objective is that given the current status of health reform implementation, devise a report card for Affordable Care Act related health reform efforts to date. This becomes extremely essential moving forward, especially given that our next module focuses on policy and advocacy. It's critical to understand what works well, so as a public health community, we can create effective advocacy efforts around these measures. We also need to understand what hasn't worked well for the same purpose. So as part of our additional resources, I've included information about the changes to the ACA that this administration has been able to get through Congress. These changes were twofold so far: expanding access, but to skimpier insurance, and scrapping federal subsidies. Our next objective is that given a prevalent community health problem, disease, or condition, develop a strategy for designing, implementing, and evaluating an evidence-based intervention. So let's jump into our first case study, the Affordable Care Act and health reform. To contextualize this case study, as well as health reform, consider President Obama's health reform principles: to protect families' financial health, to make healthcare coverage affordable, to aim for universality, to provide portability of coverage, to guarantee choice, to invest in prevention and wellness, to improve patient safety and quality care, and to maintain long-term fiscal sustainability. Before we move on, I want to go back to your public health system logic models and infrastructure maps to link healthcare coverage to our health system. As you showed through these tools, the U.S. health system can be defined as all aspects of the organization, financing, and provision of services for the prevention and treatment of illness and injury, and public health activities are an important component of this larger health system that serves the health of the public. These maps look a lot like your maps, highlighting the key components of our U.S. public health infrastructure. As many of your maps showed, access should be at the center. Maybe it should be access by people. As this map portrays, considering the social and environmental conditions in which people live interacts with our public health system, and certainly with access by people. This map also reminds us that our health system must be inclusive, if not targeted to vulnerable populations. And this infrastructure map, one that a team used, shows the relevance and importance of socio-ecological theory, something you'll want to consider when we move into public health intervention next week. More than 15 million workers, something that you portrayed in your infrastructure map in terms of public health workforce, and 3 trillion in resources, portrayed by funding, are devoted to health-related purposes. But look at our U.S. input slide. Compared to our output on a scale of other industrialized countries, what provisions in the ACA, if any, have begun to make this model more efficient and effective? The $3 trillion we spend on healthcare, more than 17% of our GDP, far outpaces other societies, as you can see here, with the U.S. being on the bottom. Keep these considerations in mind as we examine the healthcare delivery system. and where dollars are allocated. Don't forget that only about 2.5% to 3%, depending on the year, is spent on public health or prevention activity. Spent on prevention. So 17% of our GDP is larger than the entire GDP of all of these other industrialized nations, except Germany, Japan, and China. But it's still a third the size of China's GDP. Look at these actual causes of death. Is more health care the solution to these causes? Now that we understand what drives our U.S. public health system, we need to begin to answer the question of where do our advocacy efforts today in regard to upholding provisions of the ACA need to begin to intervene? What provisions in the ACA account for prevention? And at what levels of this ecological model? Our case study question asked you to choose one of the 7 scenarios listed in the case study and describe how various provisions of the ACA affected that family or individual. Then describe how the impacts on this family or individual contribute to overall goals of the ACA. As you respond, consider what is the most important issue facing the U.S. healthcare system today. Is it cost? Is it access? Maybe it's pure quality. Or is it something else? Now let's go back to the key elements of the ACA. Let's now briefly summarize key public health components that can be seen as successes. The ACA expanded access to over 30 million uninsured people through multiple strategies. And clinical preventative services are included with first dollar coverage. And the ACA has established the Public Health and Prevention Fund, as well as loan repayment incentives for public health workers. And the ACA requires hospitals to assess community health needs. Looking at the expanded coverage provided by the ACA, the uninsured rate dropped from 20% to 9%. I look forward to your analysis of the 7 scenarios presented in this case study. And now let's move in to public health implementation and evaluation. We'll start with a case study of an HIV/AIDS prevention and care intervention and evaluation effort in Thailand and Japan. Let these following questions guide your thinking for when you respond to our conferencing exercise question. Who are the key actors in the project? What's the nature of the project? What's going on in the project in each part of the case? What's the controversy in each part of the case? And what problems are Mr. Tani or Ms. Marino facing? That's actually the conferencing exercise question. And finally, let's return once more to the Gulf and our BP oil spill case study, this time from the angle of intervention and implementation and evaluation. You're to assume that you are part of the community health division of a local health department serving a coastal Louisiana community, and that you're planning an already piloted intervention that includes both individual clinical support services, such as counseling, surveillance of certain outcomes, and that'll also monitor and promote community cohesiveness and well-being through surveys and other activities. The conferencing exercise question is therefore to identify 3 major challenges, maybe social, maybe ethical, or political, cultural, legal, or distributional factors to successful implementation of the project and explain how these anticipated risks can be mitigated. You should consider strategies or approaches to address these considerations, including any needed to keep the community engaged during the 5-year period before any results from the intervention will even be available. On that note, I hope you enjoy exploring these topics and thinking about them more profoundly. And regarding the ACA and the conversation, I hope that we can all turn our frustration into advocacy. Thank you. The health insurance market reforms and exchange, subsidies for premiums, which were most impacted by one successful attempt to repeal this law, expansion of public programs, the individual mandate, also stripped away in attempts to repeal this law, employer requirements and incentives, provisions for small employers, the delivery system reforms, and shared responsibility for financing. Where is the biggest impact of the most recent changes? What's been preserved? And how can we improve all moving forward?